Hey everybody, it is Tuesday, May 19th, and once again, pleasure of Dr. Claire about the weekly update, um, uh, COVID response and what the situation is in Kenya. Hey Claire, how you doing?
Hi, Kat. It's good to see you again. How are
No,
you guys doing?
we missed last week, but sorry about that. But here we are back again today. Tell us a little bit about, give us an update. It's been a couple weeks since we gave an update for Kenya. Tell us what's going on in country, what the mood of the people are, the number of cases. Tell us, give us the lay of the land.
Yeah. So let me start with the number of confirmed cases as at this morning, Kenya time. We have a total of 912 confirmed positive with 336 recovered and 50 deaths. And the interesting thing about Kenya, unlike the US, is that we have our grandparents who live in the rural areas. And so these are areas that have not yet been affected by the COVID-19 virus. And so you find that the age group of these positive cases is mostly 59 years and below who are being affected with the COVID-19. So that's one thing that's different about Kenya compared to the West. And then generally the public, the citizens, there's a fear of, fear of the unknown, as they say, and the disease itself, because we are getting so much information and just looking at the cases, the number of cases rising with time. Which was inevitable because of the mass testing that has been rolled out in specific locations in the hotspot areas in Kenya, therefore giving that picture that the numbers are increasing, and almost doubling every day. So that's where we are.
So people are afraid, primarily in the urban areas, but you also were sharing with me earlier that there's a stigma problem with people coming from the urban areas to their rural homes. Tell us a little bit about that.
Yeah, you find that we have some cases in the country that are being highlighted of people coming into the community from the hotspot areas, that is Nairobi, or outside the community generally. And the community policing is very, very strong at the rural communities. So as soon as they notice somebody new in the community, they report that to the chief and relevant health officials, so that the person can be checked on whether or not they have any symptoms to do with the COVID-19. And obviously the first thing that is done is to quarantine these new people who come into the community. So the stigma is real. It's rising, especially in rural communities, because that is one area that they have been told to look out for as part of the community policing.
Okay. So what is the latest government action? What are the restrictions currently in place for people and so forth?
So the cessation of movement in Nairobi and Mombasa County remains and has been extended up to the 6th of June. So has the curfew, countrywide curfew, also been extended to the same period. And our markets, public markets, remain closed to date. The gatherings, depending on which county and the local administration directives, minimum of 10 to 15, maximum of 10 to 15 people in gatherings, and the masks is still mandatory to put on a mask while you're in public places.
So the curfew has been extended,
Yes.
and that's past the time that they were going to reopen schools. So they were talking about reopening schools June 4th, but now the curfew goes through June 6th. What does that do, in your opinion, to when the schools will open, and are there plans to help kids get educated during that time?
Yeah, so currently there is an education response task force that is in place, trying to supposed to give us the way forward as far as when schools will reopen. From my view, what I can see is that is a highly unlikely, because of, one, there are certain systems that need to be in place that will ensure we adhere, or schools adhere to the directives that have been given, namely social distancing and the directives with the mask, the directives with the ensuring hygiene in schools. So the Ministry of Education has to give out a well laid out plan for schools to be able to reopen. And the more disadvantaged schools will be the ones in rural communities, which are the public schools mostly. And so just ensuring that they are up to speed in terms of ensuring that directives are followed even when schools reopen. And some of these include, ensuring that the online learning platform, if we are to go that way as a country, the online platform is working well and is accessible to even rural communities in Kenya. And then another angle would be if we are to open schools and there needs to be physical presence of pupils in schools. We're looking at maybe children coming in shifts. We're looking at expanding our classrooms to create space so that the directive on social distancing is observed even in schools. So, just adjusting schools if physical presence would be the solution to ensuring that our kids get back to school and continue learning.
Great. Right.
Yeah.
Yeah, I know that we are on both sides of the bridge here talking about kind of planning for what's next, whenever next happens, right? When the country starts opening up some more, how do we help at schools once they open to physically distance kids, whether that's temporary classrooms, meeting outdoors, whatever it might be, and then also how do we help businesses open up? I know that we're in the big middle of that planning session to figure out what our response can be. So I think over the next couple of weeks, we'll be trying to put more details behind, what our response can be to get communities back to normal as soon as possible. We also heard there was supposed to be a nurses' strike. Can you give us an update on that?
Yeah, so the latest update is that they postponed their strike because they put the lives of Kenyans before their own. That was the statement made by their leader. And so they postponed the strike to resolve with their issues with the government to a later date.
Okay.
So they are at work.
Okay. All right.
Yes.
So then kind of lastly, Claire, just kind of tell us how are the churches doing in communities? What's the general mood in our communities? Are there still the activities of pastors with megaphones meeting with smaller groups of people? I mean, tell us what's going on in that regard.
That's one of the most exciting, I would say, most exciting activities that is ongoing in community in terms of responding to COVID-19. So we have the megaphones on the ground. The church leaders are using that to spread the word, as well as being our advocates for spreading the information on COVID-19 prevention and preventive measures and all the hygiene measures that need to be taken. Also relaying that information on what to do in case someone has such symptoms. So I would say the church is really active on this. They have a schedule. Each community has a schedule where the pastors' fellowship have designated certain days of the week to go around certain neighborhoods in the community to be able to do just that. And we see it's exciting for us.
I tell you,
It's something, yeah.
I can tell you're excited by your smile.
Yeah, I am very proud of them.
That's
Yeah.
great. So markets are closed. Give us an update on really the biggest concern for us on this side of the bridge for our friends in Kenya is the food insecurity issue. The most vulnerable people in our communities being able to, just sustain themselves when they're supposed to be locked down. So tell us a little bit about what you see coming in the future with that. We had talked a few weeks ago, and you expressed some concern around June and July. And so tell me, what is your latest thinking on food insecurity specifically?
Yes, Kat. So as at now, we are 1.5 months down from public markets being closed. And so if this continues in terms of if the curfew and the directives on public markets still continues, then we are looking at a greater problem than we did in April, that we had in April, in terms of there would be more people that would need assistance in terms of food distribution, and especially people who do their business through the the public markets, do their trading and businesses and earn their income through markets being open. So seeing a bigger problem if this persists for us in country.
And right now, markets are going to remain closed through June 6th. Is that right?
Yes, as at now it's still June 6th. So yeah, we don't know what after that, but we can play out different scenarios. If we open up, this is the likely scenario. If we still remain closed, then what I just explained is what would be the likely scenario.
All right. Well, thank you for all that, Claire. We appreciate it. How are you and Tyler doing?
He's playing outside. He's good. He's good. I'm grateful that his school offered to start online classes. Yeah, takes a load off my shoulder a bit in terms of making him concentrate and just, yeah. But he's doing good.
We'll also please send our best to our entire staff. I know they're working as hard as they can to try to help the people in our community. So thank them for us, if you would. Any final thoughts before we wrap this up?
Not today, Kat.
Okay. All right.
Yeah, but I'm grateful for, just being part of this, and continue praying for us. We also pray for you guys, that we position ourselves, we position ourselves for whichever scenario will play out, and just take the bold steps to act out in whatever we have planned. Yeah, the boldness and just deciding if we're going this way. Yes.
Well, thank you.
That's what I would say.
It's great to see you. Again, send our best to the staff. Appreciate your time this week. We'll talk to you again next week.
Okay, Kat. Thank you. Bye.